Okay, good afternoon. So for today, we are going to talk about the physiology of the male reproductive system. So before we start, for those of you who are not familiar on how a male reproductive system looks like, ayan siya. O, diba kinabahan kayo? Anyway, so for today's lecture, it is divided into three. We will talk about first spermatogenesis, followed by the performance of the male sexual act, and then the regulation of reproductive functions by the hormones. So for the performance of the male sexual act, kaya masyadong ma-excite, no? Hindi natin papanoodin kung paano yung actual male sexual act. So I think you know this from your anatomy that the major organ or the most important organ in the male reproductive system is your testis. Okay, and then you also have different important structures such as your epididymis, your vas deferens, and then you have your seminal vesicle, prostate gland, as well as the different glands, and then of course the penis. So later on, we will discuss the importance of these different structures. But we will not discuss it in detail. Anatomy yun, in physiology hindi. Okay? So let us first start with spermatogenesis. So from the word itself, spermato, sperm, and then genesis. Okay, so this is the production or the synthesis of the sperm cells. So spermatogenesis occurs in the seminiferous tubules, which are found inside the testes. And spermatogenesis is controlled by the anterior gonadotropic hormones, and it starts at or during puberty, so roughly around 13 years of age. Okay, although so that's the average, but it may occur a little earlier in some individuals, but on the average, it is around 13 years of age. If you will notice at the picture, this is an example of a seminiferous tubule, which was cut in crosswise. So if you will look at it, there are different stages, diba, dun sa production or sa develop of the different stages of spermatogenesis. Okay, so what happens during spermatogenesis? So if you will go back to this picture from the periphery, that is the most immature cell, and then as it goes towards the center, it becomes more mature. Okay, so when the fetus, pagpunta siya or naging male or had the male or what's it called this, nag-differentiate into a male, magkakaroon siya ng primordial germ cells for the production of sperm cells. So at birth, these primordial germ cells are somewhat, anong tawag dito, at rest, no? Or parang nandun lang sila natutulog sa loob ng testis. And then, these primordial germ cells later on, as they enter the testis, will become your spermatogonia. And just like what I have said, nandun siya sa pinaka-periphery. And then at the start of puberty, doon magsisimula yung actual spermatogenesis. This spermatogonia will proliferate mitotically to become the primary spermatocytes. And these primary spermatocytes will undergo first meiotic division to become the secondary spermatocytes. And after the second meiotic division, your secondary spermatocytes now will become your spermatids. Okay? And these spermatids will further undergo differentiation to become your mature sperm. Okay? If you will notice that from your secondary spermatocytes, after the second meiotic division, the cells now will become haploid. Okay? And then as they differentiate, it's either the cell will either contain the male or the female gene. Okay, so that is for actually the summary on how spermatogenesis happens. So as you can see again, it starts at puberty. Okay, again, this is just to show you that from the periphery, you have your spermatogonium, and then it will undergo mitosis, and then first meiotic, then secondary meiotic, and then it will undergo further differentiation to become the spermatids. Another important cell that you will notice in this picture is the Sertoli cell. Your Sertoli cells, these are non-germinal cells found in the testis. And one importance of which is that it provides mechanical support for the maturing gametes. It also secretes H and Y antigen responsible for the induction of testicular organogenesis. So somehow, di ba, isa siyang importanteng structure that makes you a male because of that secretion of your HY antigen. It also secretes Mullerian duct inhibiting factor. So pagka may Sertoli ka, definitely magkakaroon ka ng male sex or the male reproductive system, or magiging male ka, to in short. Your Sertoli cells also secretes potassium and bicarbonate rich in watery fluid, and then it also helps in the synthesis of estradiol, androgen binding protein, and your inhibin. So what are the different hormones that stimulate your spermatogenesis? As mentioned earlier, it is controlled by the anterior gonadotrophic hormones. So from your hypothalamus, once GnRH is secreted, this will stimulate your anterior pituitary, okay, to produce LH and FSH. So the role of LH is with that of your testosterone. It will act first on your Leydig cells to produce testosterone. And then your FSH will act on the Sertoli cell to either produce inhibin as well as to stimulate spermatogenesis. Okay, and then as you can see, your Leydig cell will stimulate the release of your testosterone, and this testosterone will be the one responsible for the androgenic effects or yung occurrence of the secondary male sexual characteristics during puberty. And it will also stimulate your Sertoli cells to start spermatogenesis. Okay? And so again, testosterone from your Leydig cells, very important for the growth and division of the testicular germinal cells. And then your LH from your AP, this will stimulate your Leydig cells to secrete testosterone. And then your FSH, again, stimulate your Sertoli cells. And then so to start your spermatogenesis during puberty. And then it is also very important, for the conversion of your spermatids into a mature sperm cell. Okay, your estrogen somehow from your testosterone, this is stimulated by FSH. So may role din pala yung estrogen for spermatogenesis. And then your growth hormone, this is controlled. It controls yung metabolic function of the testis. So very important din na meron pang growth hormone. This will promote yung early division of your spermatogonia. That's why in severe growth hormone deficiency, this may lead to infertility. Okay, so how does a mature sperm looks like? So a mature sperm is composed of your head and tail. So if you will look at the head, it has a condensed nucleus and a very thin cytoplasm and cell membrane. So manipis lang siya, no? So it is prone to destruction actually. But however, in the presence of your acrosome, yung acrosome kasi para yung helmet. Okay, it acts as para siyang helmet. So it somehow makes the head stronger kasi nga thin yung cytoplasm and cell membrane ng the head of the sperm. And if you look at the picture inside the head, meron kang mga vacuoles and then which contains enzymes. Later on, we will talk more about it. For the tail, it has a central skeleton. It also has a thin cell membrane, but it has a rich collection of mitochondria. This is very important, yung presence of mitochondria in the tail, because the tail needs energy in order for the mature sperm to become motile or motile. Okay? Yan. So, how does maturation occurs? Okay? If we mentioned a while ago that the spermatogenesis occurs in the seminiferous tubules. And then once the spermatids differentiate into a mature sperm, somehow yung sperm daw na yon after yung differentiation, um, morphologically mature siya. Pero physiologically, hindi pa siya mature. Okay? So, our sperm cell coming from the seminiferous tubules, it will pass through the epididymis going to the vas deferens. As the mature sperm moves through the epididymis, it will somehow become motile or motile. But still, it will not reach yung full motility niya, which is found in an actual mature or dun sa mature sperm talaga. And then once it reaches the vas deferens, it will go again somehow lose its motility. No, habang nakastore siya doon, hindi siya ganun ka-active. Kaya nga yan, deeply suppress yung cells kapag ka nakastore sa vas deferens. And take note that around 120 million sperm cells are produced per day. Okay? So when does the sperm cell acquire yung motility niya? Or nagiging fully mature siya. Yan, once after ejaculation, kapag nag-lyse na yung semen, later on we will talk about it, doon niya ma-attain yung full motility niya. And that's the only time na talagang considered fully mature or physiologically mature na yung sperm cell. Okay? Yan. So, as mentioned, a mature sperm is considered physiologically mature once it is motile, or meron na siya ng flagellated movement. And a mature sperm can travel around 1 to 4 millimeters per minute. Then it is noted to be active in a neutral or slightly alkaline medium. But yung activity niya actually, so although active siya in neutral and slightly alkaline medium, yung activity niya actually increases further if the pH is acidic and if the temperature is high. Okay. However, if magstay siya for a longer period of time sa acidic environment as well as sa hot environment, what will happen to the sperm cells? They are easily destroyed. Okay. So mas preferred nila somehow yung alkaline medium. But again, kapag na-expose sa acid, they become more motile as well as nagiging more active as well as higher temperature. Yun nga lang, mas maaga din silang nasisira kapag ganun. Okay? That's the reason why sperm cells can only last for around 1 to 2 days inside the female genital tract, because we all know that the female genital tract is acidic. So luckily, for the boys, you have the so-called semen. Okay, semen. And this is what we actually see after ejaculation, is the semen. And this semen is milky as well as mucoid in consistency. So inside that mucoid substance or yung semen, nandun yung sperm cells. So hindi after ejaculation masasabing, oh yan yung sperm cell. No, that's wrong. But what you actually see is the semen or the semen. Okay. So 60% of the semen comes from your seminal vesicles, 30% from the prostate gland, and around 10% from the vas deferens. And a small amount comes from the mucous glands such as your bulbourethral glands. And semen has an alkaline pH, which is around 7.5. That's why when the sperm cells are in the semen, they prefer that environment. They can last longer. Basta nandun siya sa semen. Diba? And then, this semen forms a weak fibrin coagulum. Kaya nga, ang itsura niya mucoid, para siyang before, paano ko ba ito ma-explain so that yung mga iba pa sa inyo na hindi pa nakakakita ay ma-imagine, para siyang Malabnaw na taho. Tama ba yun? Parang ganyan. No? Anyway, so this coagulum, it dissolves within 15 to 30 minutes. That's why you will notice that after ejaculation, initially, yun nga, mucoid siya. And then later on, magliliquefy. No? Magliliquefy yung semen. And that is again very important. In order for the sperm cell to attain its motility. Okay? Yan. So as mentioned, majority of the semen comes from the seminal vesicles. So as a review, your seminal vesicle is a tortuous loculated tube lined with secretory epithelium. And they secrete no mucoid rich in fructose, citric acid, prostaglandins, and fibrinogen. So again, your seminal vesicles secretes no, yung main bulk of the semen. Okay? So what's the role of why is it importante yung prostaglandin daw? Your prostaglandin aids in fertilization by number one, first, reacting with the female cervical mucus. So once it reacts with the female cervical mucus, it makes the environment more conducive for the sperm cell, no? Or more, ano bang ganito? Favorable for the sperm cell, not pala hindi conducive. And then aside from that, it causes backward reverse peristaltic contractions in the uterus and fallopian tube. So paano yun? So let me try to draw. Wala kasi akong pang-draw ngayon dito. But para mas maintindihan natin kahit papano. So try to imagine if this is your ovary. Diba? Then you have your fallopian tube. Ganyan. Fallopian tube going to your uterus. Diba? Going to your uterus. So then this is your cervix. Tapos this is your vaginal canal. Kunyari ganyan, no? So I hope you can see the drawing. So yung semen coming from the ejaculation, your prostaglandin now will react with the uterus and the fallopian tube. So remember that the egg cell coming from the ovary, ang movement ng fallopian tube and will be towards the uterus. Okay? Para yung egg cell makapunta dito sa may malapit sa uterus, di ba? Sa may ampulla. In the presence of your prostaglandins, it makes the movement backward. So pabaliktad naman. So importante yun para somehow, di ba? Even kasi sabi nga natin, yung mga sperm cell coming from the vagina as it enters the cervix and the uterus, somehow it will help no, yung propulsion ng sperm cell pabunta naman doon sa ampulla in the presence of your prostaglandin. So para kung merong egg cell dyan, madali sila makakapag-meet yung sperm cell and as well as your egg cell. Okay? So yan, it aids possibly causes backward reverse peristaltic contraction, sabi niya. Okay? Yan. How about the secretions of your prostate gland? So kung kanina, the seminal vesicle mucoid yung secretion, for the prostate gland, ayan, thin milky secretion, this time rich in calcium, citrate ion, phosphate, and then clotting enzyme, and profibrinolysin. Kung kanina si seminal vesicle yung responsible for the mucoid appearance, yung secretion naman ni prostaglandin, yan, yung profibrinolysin, they're the one responsible to lyse that mucoid. Okay? So it also helps in making the semen alkaline. So therefore, it helps in the buffering of the vaginal secretions kasi nga acidic, di ba? So it somehow makes yung vagina more favorable environment for the sperm cell. As mentioned, sabi natin, they prefer yung sperm cell nga, prefers yung alkaline environment kasi nga hindi sila agad madedegrade or masisira kung alkaline. Pero pagka nga, sabi natin, in a more acidic environment, they are more motile. Ayan, optimal motility at pH of 6 to 6.5, and that is acidic. Yun nga lang, mas madali, mas destruction they are easily destroyed when they are in an acidic environment. Okay? So a while ago, we have mentioned that after yung nag-lyse na yung mucoid, tapos nandun na siya sa vagina, the sperm cell now will attain its motility. Okay? It will attain its full motility. So mabilis na, no? Yung flagellated movement, ma-attain na niya. And then it will pass through the cervical mucus. Aside from the acrosome, ang isa pa kasing content, no, nung head ng anong tawag dito? Ng sperm cell, meron yung mga sterol compounds. Okay? So as it, di ba sabi natin yung semen, rich yon in calcium as well. Okay? So yung calcium na yon, kapag na-expose na yung sperm cell doon after yung lysis ng mucoid, kapag nandun na nag-liquefy na siya doon sa vagina, your calcium now will bind to the calcium receptors found in the head of the sperm cell. So that will also help in the motility of the sperm cell. So mas magiging motile yung sperm cell natin. So yung sperm cell mo now will pass through the cervical mucus. And as it passes to the cervical mucus, yung mga sterol compounds doon sa head ng sperm cell, it aids, no? Actually, yung sterol compounds na yung cholesterol, it also makes the head stronger. Okay? But as it passes through the cervix, yan yung cervical mucus, yung mga cholesterol na yon natatanggal. Natatanggal sila. That's why if you will notice, kita mo yung drawing dun sa may uterine environment, natanggal na yung cholesterol components. So because of that, na-expose yung sialic acid binding protein. And then, maliban pa doon, nagiging weak yung head ng sperm cell. Okay? That's why pagdating niya doon, kung meron siyang ma-meet na egg cell, okay, so weak na yung head, di ba? Yung sperm cell now, the acrosome, once it attaches to an egg cell, it will release yung hydrolytic enzymes present in the acrosome. And these hydrolytic enzymes now will digest the wall of the egg cell. And as it do so, pag open up na yung wall, di ba? Yung genetic material ng sperm cell will now be released from the sperm cell into the egg cytoplasm. And once that happens, yun yung tinatawag nating fertilization. Pag na-release na yung nuclear material ng sperm cell into the egg cell. So hindi enough na, excuse me, sorry. Okay, my apologies for that. So, yun. So once na pumasok na yung nuclear material, yun na yung tinatawag nating fertilization. So that is also yung tinatawag nating acrosome reaction. Yung kanina, this is the capacitation of your spermatozoa, yung attachment ng calcium and then the removal of the cholesterol to expose the head of the sperm. That is your capacitation of your spermatozoa. Okay, so let us now look at abnormal spermatogenesis and fertility. So there are different events that can destroy your seminiferous tubules, which can lead to infertility or which can affect your spermatogenesis. So one of the first one is yung tinatawag nating bilateral orchitis. So when you say orchitis, this is the inflammation of the testis. So this is one of the complications of your mom's infection, di ba? Yung tinatawag nating beke. Kaya nga yung iba, di ba, pag sinabing, oh, nagka-beke, naku, mababaog ka, ganyan. Because pag you have the mom's virus, it can actually infect or affect your testes. So if one test will be inflame, okay yun. At least meron ka pang isa. Pero kung bilateral, there's a high chance na maging infertile ka because of the destruction of your seminiferous tubules. Another one is yung pwedeng inborn. No? Meron ka na talagang problema with the seminiferous tubules. And then, another thing is yung typhoid fever. Pwede siyang maging complication is yung destruction of the seminiferous tubules which can lead to infertility. Another one is the effect of temperature. Okay? So yung increased temperature prevents spermatogenesis. And then yung prolonged exposure to an increased or a hot environment can destroy also your seminiferous tubules. That's why fortunately for males, meron tayo ng scrotum. Di ba yung scrotum, nandun yung testis if you remember. And yung scrotum, para yung aircon, no? Cooling mechanism daw yan ni testis. So your scrotum, it maintains 2 degrees Celsius difference between the body and the testis. Kasi nga, yung temperature ng body natin, especially yung abdomen, that is a little hot for the testis. So it can affect the production or it can affect the seminiferous tubules and which will in turn affect the spermatogenesis. Kaya daw in the presence of the scrotum, kapag mainit yung panahon, so mas mainit din yung katawan ng lalaki. So what will happen now is that the scrotum will move downwards, bringing the testis farther away from the body. Pero kung malamig naman, ang action ng scrotum will go up. So it will move the testis towards the body para hindi rin siya masyadong malamigan. So dapat mag-maintain lang ng 2 degrees Celsius difference between the body and the testis. Okay? This is another reason why if you have read articles, no, yung mga, ang isa daw, isang, what do you call this? Effect ito no, nung mga truck drivers before, no, especially yung mga kabag siguro walang aircon. Because remember, okay, so going back, yung sabi nga natin yung mga truck drivers, remember yung ibang trucks, mga mid-engine kung tawagin dyan, yung the engine of the trucks are placed dun sa parang under the seat of the or the seat of the driver. It's actually above the engine of the truck, and that engine will emit heat. So that heat coming from the engine can somehow can affect no, the testis. Kaya nga yung iba daw before, yan yung isa sa mga occupational hazards ng mga truck drivers. Okay? Another problem that may cause infertility later on is cryptorchidism. Cryptorchidism is the failure of testis to descend to the scrotum, or in other words, ito yung maririnig yung undescended testis. Because remember, during fetal life, the testis is actually an abdominal organ, or it is placed in the abdomen. And then at around 3 weeks to 1 month before birth, dun pa lang siya bababa sa scrotum. Okay, there are some cases wherein the testis will remain inside the abdomen. And because of the higher temperature in the abdomen, pwedeng masira yung testis na yun. Okay? So, it has been found out that the failure of descent of the testis is due to inadequate testosterone during fetal life. Okay? And then, another cause of infertility is actually the sperm count itself. Okay? Let us remember that per ejaculation, you will secrete around 3.5 mils of your semen. And per milliliter of semen will contain around 120 million of sperm cells on the average. That's why per ejaculation, kung 3 mils yun, 120, roughly 400 million ang content or ang sperm cell present in the ejaculate or ejaculate. So in order for a male to be considered normal in terms of sperm count, dapat daw at least 35 million and above ang kanyang sperm cell. Okay? Kasi kung below 20 million ang sperm count mo per ejaculate, you are already considered infertile. Okay? Kaya nga sinasabi, di ba, lahat tayo champion. Kasi nga, biro mo, 400 million average, and then ikaw yung nabuo. Isang, di ba, champion sperm cell ka daw. Okay? Yan. Another problem or cause for infertility is the effect of morphology and motility. Okay? So, a normal sperm cell should look like itong nasa left. No? Somehow the I'm sorry, the one on the right. No? Dapat yung head mo is proportional to the size of the tail. No? The head somehow balance yung size ng head dun sa tail. Okay? Kasi kung titingnan mo yung sa pinaka-left, no? Maliit yung head tapos ang kapal ng tail. So kapag kaganyan, na mabigat yung tail niya, mahirapan siyang mag-move. Okay? So ma-affect, the motility will be affected. Lalo na kung ganito, dalawa yung head, then one lang yung tail, tapos abnormal looking pa yung tail niya. Dun sa second picture from the left. So definitely it will affect yung movement. Or ito, yung sa third one, di ba parang alien, dalawa yung tail, no? So again, that will affect the movement of the sperm cell. And then yun, the fourth one from the left, no, very small naman yung head. Then makita mo yung fifth coil, ganun din yung sa sixth, short yung tail. And then dun sa next to that, very long yung tail, thin and long. And then medyo maliit din yung head. Yung sumunod naman, no, magpansin nyo, di ba? Pati yung color niya, iba na. This is how a dead sperm cell will look like. No? Crooked na yung tail niya, saka S-shape na siya. Yan. So again, sorry for that. So yun nga. So dapat balance, no? Proportional yung head to the tail para ma-attain niya yung movement niya. Okay? Yan. And then sabi ko nga before, yung movement kasi ng sperm cell dapat parang band. No? Are you familiar with that band? One direction. Oh, yan, 'di ba? So tingnan natin kung ano daw itsura dapat ng movement ng sperm cell. Yan, no, tingnan niyo, isa lang yung movement niya, 'di ba? Meron siyang flagellated movement, no? Very motile yung tail. That ang movement niya straight lang, hindi siya lumiliko. Okay? Yan, no, very fast yung movement. No, kita niyo yung iba yan, no, dead na yung mga sperm cell, iba itsura, but this one very strong. Okay? And this is the flagellated motion in slow-mo. Ayan, nakita niyo 'di ba? Flagellated para siyang whiplash movement, no? Whiplash action yung latigo, sabi nga. Okay? So that is how the sperm cell should move. Okay? Okay. Yan. So yan yung effect ng morphology, temperature, cell count sa infertility. Let us now look at male sexual act. Okay? So, what is the most important source of sensory nerve signal for initiating sexual act? Diba? Ano daw yun? Or yung source, pinaka-importanting source. Okay? So, yan. Yung glans penis. No? So, glans penis. So, kaya nga, di ba kasi yung glans penis, it has a lot of nerve endings. That's why it's very sensitive. Diba? Kaya nga sabi ng matanda, wag lang di masaling. No? Ibig sabihin, konting touch lang. No? Diba? Nagiging erect na yung glans, yung penis because the glans penis itself has a lot of nerve endings. That's why it's very sensitive. Okay? Yeah, no? Special sensitive and organ system that transmits sexual sensation. Okay? And then there are also the structures nearby the glans penis or the penis itself may also send impulses which will initiate sexual act. Diba? Hindi lang daw mismo yung glans penis but the structure itself, ano ba yung mga nasa paligid nun? The scrotum, no? Perhaps yung pa ibang structure doon. Diba? Alam nyo na yun. para huwag tayong maging mahalay. Okay? But for the males, aside from yung glans penis itself, the psychic element, no? Anong ibig sabihin nun? Yung psychological, meron ding factor. Di ba? Kaya lalong-lalo na sa male. That's why, di ba, yung mga males during adolescent, they resort to what? Yung mga videos, magazines, no? Pag nagbasa sila, di ba? Kaya yung, I think it's part of growing up talaga yun. Kaya yung mga male, di ba, makakita lang ng ano, na stimulate na sila. Okay? Kasi merong psychic element din. Okay? So once na-stimulate, this will lead to penile erection. And penile erection is actually controlled by your parasympathetic nerves as well as your sympathetic nerves. For lubrication and then emission and ejaculation, this is controlled by your sympathetic nerves. Okay? So I think that's for the actual male sexual act. Huwag na tayo masyadong mag-isip pa ng kung anong video. Okay, so let's continue again. This time with the control of male sexual function by hormones. Although earlier we already have mentioned yung different hormones that's important. So we have seen this picture already. So as mentioned, testosterone secreted by the interstitial cells of Leydig. So it comes from cholesterol esters. Okay, so 65% of the testosterone are bound to albumin. Okay, 30% bound to testosterone binding globulin, and around 9% they're attached to plasma proteins. Okay, so this is the major hormone produced by the Leydig cells. They are mostly converted to dihydrotestosterone. So your testosterone, marami siya during the first few months of life, and then it will decrease, decrease until you reach your puberty again. Doon niya palang uli ma-reach yung adult amount ng testosterone. And then take note that small amount is secreted by your adrenals. Diba? But yung actual yung bulk ng testosterone needed for you to have the secondary male sexual characteristics that will come from your testosterone. Yung small amount secreted by the adrenals, hindi yun enough for males to attain secondary male sexual characteristic. Diba? Kaya nga yung females naman, because of the presence of testosterone coming from the adrenals, pag medyo napadami, ano nangyayari? Diba yung kaya yung mga females, iba medyo balbon. No, the reason for that is because of the testosterone coming from the adrenals. Okay? And then you also have your androstenedione. This is secreted by the testes. Also an important precursor of estrogen in men. Tapos, most of the estradiol nga are from blood testosterone. Okay? And then as mentioned, yung testosterone is mainly in the form of dihydrotestosterone. And this is after the action of the 5-alpha reductase. And this 5-alpha reductase also is secreted by your Sertoli cells. Okay? Although, sabi nga natin, majority of your dihydrotestosterone is coming from the conversion of the testosterone. Around 20% is directly produced by the testes. And then your dihydrotestosterone has more than twice biologic activity compared with testosterone. Okay? So ito, alam niyo na to, na-discuss na rin sa inyo to. Okay, so again, diba, your testosterone is very important for the masculinization. Okay. During fetal life, ang stimulate for the release of testosterone is your HCG, your human chorionic gonadotrophin. Okay, but after that, after delivery, di ba, bababa ang testosterone, and during puberty, ang mag-stimulate na ng release ng testosterone would be your luteinizing hormone. So, sabi nga natin, hindi siya present during childhood. Okay? And then, yung testosterone during fetal life, this is responsible for the testicular descent. Okay, this is a graph showing us that during fetal life, medyo mataas yung amount ng testosterone, bababa lang siya, and then may konting spike during neonatal period. And then, kasi nga, before delivery, di ba, during fetal life, para magkaroon ka ng male sexual, magkaroon ka ng male sexual reproductive organs. And then, before delivery, tataas uli yun kasi kailangan yung sa descent, no? Yung descent ng testis. And then, after that, ng neonatal period, halos wala ka ng testosterone. Ayan, no? Mababa. Coming from the testis, but you still have that from the adrenals. And then, after that, during puberty, makikita mo, tataas uli yung production mo na ng testosterone. And in here, you will also see yung sperm production kasi nga, you need your testosterone in order for spermatogenesis to occur. Okay? And then, up to around 50 years old, you will now start to have decrease in your testosterone. And then, although your spermatogenesis will continue, but at around 70 to 80 years of age, dun mag-start mag-decline yung iyong spermatogenesis. Okay? So, as mentioned, we need your testosterone coming from the testes for the development of your adult or yung secondary male sexual characteristics. And ano ba yung secondary male sexual characteristic na yun? Yung distribution of body hair. Okay? So makikita nyo, no, especially yung mas maraming production ng testosterone, dami silang body hair, di ba? May bigote, balbas, ang iba mas balbasarado. Okay, then makikita nyo yung extremities nila are full of hair, even yung chest hair and even in the abdomen. Yung iba mas maraming testosterone, kaya mas marami silang body hair na napoproduce. Okay? However, pagdating naman sa ulo, ang problema nun, di ba, yung typical male pattern of baldness, no, yung either it will start from the top, no, yung bilog, tapos unti-unting mag-recede yung hairline mo. And then another important effect of testosterone is with that of the development of muscle. And take note that the larynx, meron din yung mga muscles, di ba, and tissues. So yung thickening ng tissues and muscles, because of the testosterone, it will also affect yung voice production ng male. Kaya nga pag nagbibinata na, di ba, lumalaki lalo yung boses ng mga lalaki. So, or yun, mas nagiging deeper yung voice. That is actually because of the effect of testosterone. Okay? Ang isang effect pa nun sa skin, thickening of skin. And then yun nga lang, sadly, yung production ng acne. That is because of your testosterone. Ayan, kaya pala talaga yung mga males, no, by genetics and because of the effect of testosterone, makapal talaga yung mukha nila because of the thickening of skin. Okay. So it also affects protein formation and thereby, yun nga sabi natin, muscle development. Kaya makikita natin, di ba, more muscular yung mga males. Kaya nga, di ba, yung iba, yung mga gumagamit ng okay. Yan, aside from increased muscle mass, it also increases bone matrix as well as calcium retention. It increases the basal metabolic rates in males, increases red blood cells, and then it also increases sodium reabsorption as well as water retention. Kaya yung males, initially, di ba, because of the increased basal metabolic rate, I'm sorry, not initially, but because of the increased basal metabolic rate, it also increases yung production ng kanilang red blood cells. And then, because of the increased sodium reabsorption and water retention, mas prone ang male sa hypertension earlier in life. Okay? Yan, ano naman tong male climacteric? Diba? Ito yung opposite ng menopause sa females. Okay, so this is the decreased sexual function secondary to the decreased testosterone. So if you remember the graph earlier, diba, mentioned that around 50 to 60 years old, mag-start na mag-decrease yung testosterone mo. Okay? So that you will now start to have yung male climacteric na tinatawag. So average age is around 68 years old. So you may have the manifestation ng hot flashes, suffocation, and as well as sometimes psychic disorders. Hindi naman grabing psychic disorders. Siguro mga topak-topak, di ba? Okay? Di ba yun yung sinasabi natin pag nagbe-menopause naman yung females para silang mainitin ng ulo. Okay? These are some of the effects of your testosterone and dihydrotestosterone. Okay? Depending on life stages. Okay? What if you have abnormalities naman daw sa male sexual function? So number one, let us look at abnormalities of the prostate gland. So during childhood, maliit pa yung prostate gland natin. And then yung prostate gland daw will increase its size due to the presence of testosterone. So by puberty, unti-unti na rin lalaki yung ating prostate. Ano yung tinatawag na benign prostatic fibroadenoma? This is usually seen among older men. And because if you remember your anatomy, the urethra will pass through the prostate. So kapag ka nag-enlarge yung iyong prostate, or medyo tubigas, that can lead to obstruction. But this benign prostatic fibroadenoma is not actually secondary to increased testosterone. So walang effect kung tanggalin mo man yung testis or bigyan mo ng ibang gamot against testosterone or yung merong opposite effect ng testosterone like your estrogen, wala siya effect sa benign prostatic fibroadenoma. Okay? Kaya ito usually dapat either tinatanggal yung prostate or ino-operahan sila. How about yung cancer of the prostate? This occurs in around 2 to 3% of male deaths. Or I'm sorry, not occurs. It's cause of 2 to 3% ng male deaths. Okay? And they have found out, pag yung cancer ng prostate, yung malignant, this is secondary to testosterone. Okay? The more testosterone that you have, mas mabilis yung growth ng cancer cells. So by removing your testes, magdidikis yung testosterone mo, this will also inhibit the growth of the cancer cells. So helpful dito yung pagtanggal ng testes sa mga malignant na prostate CA, as well as magbe-benefit sila from the administration of estrogen. Okay? Ano naman itong hypogonadism? So if you will look at this one, tingnan nyo itong picture na to, di ba? Makikita nyo, ano napansin nyo? Di ba? Maraming fats, wala siyang masyadong muscle, hindi pa ganun ka-develop yung bone structure niya. And then wala siyang secondary male sexual yun. Aside from that, wala rin siyang pubic hair, wala siyang body hair. But this is actually an adolescent, teenager to. So ano nangyari? So wala siyang testosterone due to hypogonadism. If you will notice as well, di ba, very small yung penis niya. Ito yung actually yung tinatawag na infantile penis. Kasi kung makakita kayo ng baby, that is how a penis of an infant looks like. Pero ito, teenager, adolescent yan. And yet, infantile yung kanyang penis because of hypogonadism. Okay, what if may hypergonadism ka naman? So, mas madami than usual, and this can be due to tumors ng Leydig cell. Although this is very rare, okay, it may lead to 100% increase ng testosterone, which may lead to rapid growth of muscles and bones. However, kahit na rapid yung growth ng bones, maaga rin magko-close yung mga epiphyses. So it will lead to slightly small stature. Medyo maliit yung bata, yung tao, individual, but very muscular. Kaya yung mga may hypergonadism at an early age, makita nyo, very muscular sila pero small stature. Okay? I think that's the last slide. So again, thank you very much and have a nice day.